All right. As we go live and as people join, I just want to welcome everyone to the Manny's Super Civic Cyber Conversation. We have definitely the biggest panel we've ever had on Zoom so far, and I'm so excited and honored and lucky to be handing this off to my good friend Daniel Redman. But before we do that, I just want to let everyone know that this is our effort at Manny's of continuing to civically engage the public in this time of need. Even though our physical space is closed, the work is not over. And so I think this is our 90th civic cyber conversation in a month, and we've been really, really honored to do it. You can tag us at Welcome to Manny's, and I know Daniel will tell everyone, will let you know about everyone that's here, but we have a lot of really incredible organizations represented. I just want to say on behalf of Manny's how honored we are to have them and how important this issue is. And with that, I will hand it over to my most extraordinary friend, Daniel Redman.
Manny, you're too much. So first off, I just want to thank you so much to Manny, not only for providing this opportunity for the panel today, but just for providing such an extraordinary hub of positive work and activism in the city. It's just extraordinary, and it's inspiring to me and so many people. And I also just want to thank all of the panelists who are here today. These are the people on the front lines doing the work in this crisis, and it is an incredible privilege to hear from them about what they're seeing and what all of us can be doing. So tonight on the panel, the idea is, number one, to let you know about the challenges that LGBT elders face and to frame why this moment is so particularly fraught for them. And then to hear from these leaders on the front lines about what they're seeing, what challenges they're encountering, what work they are doing, and again, to share ways that you can get involved in this work. So very briefly, what is the situation that faces LGBT elders? And again, this is the situation that was facing LGBT elders before this crisis hit. I think it's fair to say that this is a crisis hitting an already particularly vulnerable community. So LGBT elders are already 20% as likely as straight seniors to access services. They're half as likely to have family help as straight seniors. The majority are single, have no primary partner. Families of choice, which are so crucial to LGBT communities, tend to be in the same generation. And so when folks are sick at the same time, it's a challenge for people to care for each other. While there's a myth of gay affluence, as one economist puts it, LGBT people are more likely to be poor than straight seniors. And speaking particularly about the trans community, trans seniors face extraordinary barriers to accessing medical care. In one recent report, 19% reported being refused care outright. And so again, so to introduce the folks who are with us today, we have Shireen McSpadden. She's the Executive Director of the San Francisco Department of Disability and Aging Services. We have Ashley McCumber, who's the CEO of Meals on Wheels of San Francisco. Clair Farley, who is the Director of the San Francisco Office of Transgender Initiatives and the Chair of the LGBT COVID Collaborative. Kaushik is here, and he's the Executive Director of Shanti. Karyn Skultety has joined us, and she's the Executive Director of Openhouse. Toby, who is the Senior Center Director at the Curry Senior Center. And I'm Daniel Redman. I'm a partner in the estate planning group at Simon & Bancroft, and I've been involved in LGBT elder activism for most of my career. And what each of the speakers will be sharing tonight, again, what are they doing? What are their organizations doing in this crisis? What are the challenges they're seeing? What can you do to help? And so, and also as questions come in from the audience, we will attempt to answer these questions during the panel. In the event that we run out of time, we want to make sure that all questions are answered. So please don't hesitate to reach out to any of us to make sure that you get your question answered. And with that, I'm going to direct it to Shireen. Shireen, could you tell us what the department is doing, what challenges you're seeing, and how folks can assist?
Sure, thank you, Daniel. So the Department of Disability and Aging Services provides services to older people, so that means people 60 and older, and people with disabilities in San Francisco. And generally speaking, we serve close to 70,000 people and work with a lot of the people on this Zoom call to provide those services. And right now, I think what we're seeing is we're seeing what you already referred to, Daniel. We're seeing where all the gaps in the system are, and gaps in the system tend to affect LGBTQ people disproportionately, also tend to affect older people and people with disabilities disproportionately. So we're really seeing that our system is falling short of being able to serve everyone. So even in the best of times, it would be falling short. That said, I think that the community has really come together to stand up new services, to expand services, to really be there for our LGBTQ seniors. It's been really helpful to have this group get together and kind of say, kind of like share ideas and listen to each other about what people are seeing on the ground. And I've been really, it's been really fulfilling to me to be able to be part of that effort. One of the things that we're doing, I guess the biggest thing we're dealing with in the city in terms of the number of calls we're getting is about food. So literally over 90% of the calls we're getting are about food and people's concern about being food insecure. And we have stood up some really good and expanded some systems to really address that. I think the other thing that people are concerned about is home care. And this is across the board for all older adults and people with disabilities, and others on the call can get into more specifics about the LGBTQ communities, but we're seeing that as well. And so we're really trying to put together systems to make sure that people don't lose a caregiver, or if they lose a caregiver, then hopefully we'll have somebody to replace that person short term, so that people do not end up, going to the hospital and taking a bed that really should be for somebody who's sick or needs treatment. We've worked with various partners to really help expand the volunteer system. We've had an outpouring of support from the community. And so there's just been a lot of great things, and people tend to really rise to challenges like this. And it's been really gratifying to me to see that happen.
Thank you so much, Shireen. And it's my understanding that that DOS has also been doing volunteer coordination. Is that the case? And if so, how can people get involved in those efforts?
So DOS has worked with the Office of Transgender Initiatives, and we've worked with Shanti. And so, and Claire can talk about the Office of Transgender Initiatives approach, or Karyn can. DOS is contracting directly with Shanti to have them help with the overflow of need that comes through our helpline. So people who need food, or they need, medicine delivery and things like that, can call our office. And we have a variety of places we can send them. We can send them to Meals on Wheels, and they've really upped their volunteer capacity. We can send them to other food programs, and we can send them to Shanti. And Shanti is taking them and really working very closely with people who are in need and matching them with volunteers. And then I'm going to give it over to others to talk about the other volunteer program that we're working with.
Fantastic. Thank you so much, Shireen. And with that, let's hear from Ashley about the work that Meals on Wheels is doing.
Well, first of all, thanks to Manny for hosting these great conversations, and Daniel for pulling this esteemed panel together. I'm really honored to be a part of it. Meals on Wheels, just as a refresher, is the largest provider of home delivered meals for seniors who are homebound, and also adults with disability, those who are under 60 but present as our homebound seniors do. And so forth. We serve about 3,600 active clients through home delivered meals, home delivered groceries, and other services. And in addition to that, we're providing the meals for the city's homeless navigation centers. So as you can imagine, this is quite a busy time for us. And it's obviously a challenging time for us. So that's basically what we do. We deliver, if you can imagine, 2.2 million meals a year, just in San Francisco. You know, when we kind of bringing up the conversation of what's happening during COVID-19, I kind of like to start by saying we do what we're doing now every day, any day. It's just that we're operating under a circumstance where so many more people need the services that we have. You know, it's really interesting as a provider, a safety net provider, we always prepare for earthquakes, which means in the food delivery system, we bring people to places to feed them. And this has turned that on its head. And Shireen has mentioned that many of those ecosystems have really responded to be able to bring food to people's homes. So that's really, really fantastic. But we were prepared for a different disaster, and now we're basically building this plane as we fly it. To a large degree, and trying to improve every single day. What we've done at Meals on Wheels is really set some core principles from 6 weeks ago. The first thing that I had to do as the leader of this organization is to say, I need to keep my people safe. And if I keep my people safe, then our clients will be safe. And so that's our guiding principle every day. And when we moved beyond that, we felt that it was our job as Meals on Wheels San Francisco to make sure that we did not add to the burden, that we kept operating, that nothing would interrupt our operation. We would serve the core clients that we have. And then if we can and we have, expand that services to the homebound seniors, the homebound adults with disabilities, the navigation center meals, et cetera. And once that is completed, then if we can do more, then we will. And so we have kind of done all of those things. We've really turned our whole core being on its head. I mean, we're not an organization that drops meals. We're an organization that wants to see people, that wants to connect with people, reduce their isolation, make sure they're safe, make sure they have a broader community to connect to. So this has been a real challenge for us to say that our number one job is not to touch people. Honestly. And so we've implemented a no contact delivery system, and we continue to do social work by phone, and practically all other services, Daniel, have stopped, and so forth. So Shireen mentioned, you know, the vast increase. I just want to qualify that. In the last 24 days, we have started 318 clients. Just to give you kind of a comparison, how that compares to a normal week, we generally start about 20 clients per week. We're now starting over 60 clients per week. And so it's a dramatic need, and we're only touching a very small portion of that need. To really talk about the direct relationship we have with the topic today, about 8% of our clients are LGBTQ. I think that number is low because we have about 25% of our seniors who refuse to state. And I think in that number are people of a generation who are not comfortable stating their identity to an entity like Meals on Wheels or anyone else. So I do think that number is certainly higher than that 8%. Daniel, you asked a question about what we need, and I will say a couple things, not just for Meals on Wheels, but for all nonprofits that people support. If you've attended an event that's canceled for an organization, make darn sure that you're giving those gifts even if the event doesn't happen. That's the number one thing that you can do, because that's really a place where all of us are hurting. We lost an event in May that produces $3 million of our budget. Luckily, a lot of people have stepped up to make sure that we're not left unwhole. So that's the number one thing. In terms of volunteerism, we have actually started kind of backing off of volunteerism a little bit for one specific reason. I think it'll make sense. We need to create a smaller community so our safety every day is really protected. And so having 10, 20, 30 people in our buildings every day is not really a safe practice. But we still need volunteers, and you can go on the site to do that, to volunteer at mowsf.org/volunteer, and you can sign up, and we will call people if we need them for various things, including the home delivered grocery program. A closing thought is, I've just been thinking now that we've gotten into our new looks like for the foreseeable future, is really a question, is the kind of the day before COVID-19 question, like, why does it take a pandemic to uncover all of this unmet need? Why is it that we just now see the horrible living conditions in SROs and homeless shelters, on the street, all of these things? Why is it that when we have a lot of people touched by being homebound without food, we suddenly need to give them 3 meals a day, but if you look across the state, most places are only giving 1 meal a day? So I do think that as we progress through this crisis, we need to look back at the lessons learned from it and really ask ourselves, why aren't we doing some of these things every day, any day?
Ashley, thank you so much for what you shared. I'd like to now turn to Clair Farley. And Clair, why don't you tell us the work that the Office of Transgender Initiatives and the LGBT COVID Collaborative are up to?
Thanks so much, Daniel. It's great to be with you all, and thank you, Manny's, for hosting us. At the Office of Trans Initiatives, our work is really focused on those who often are not accessing services or programs citywide. We're a strategy office, so we really focus on providing technical assistance and capacity building, as well as working to implement citywide policies and community events to help bring us all together. When this all came about in the state order, organizations had less than 24 hours to shift their entire operations, and we were there with them to try to provide as much support as we could, really to support the public health of our communities. And so we've been successful with that through this stay-at-home order. But one thing we noticed is that, oftentimes LGBT organizations, even in San Francisco, are already strapped with capacity and resources. And so we wanted to have a way where we could all come together and have a regional approach. So we started hosting weekly calls and really listening to organizations around what the gaps were. And one of the first things that came up was really looking at how do we support our seniors who don't have the same opportunity, or adults with disabilities, to go out and get groceries, or may not have connection to family or friends who could provide those. So in partnership with Karyn from Openhouse and DOS, we really looked at how can we create a kind of a citywide volunteer match program. And so we partnered with Shanti and Openhouse and others to really look at how can we make sure we get folks groceries, in addition to all the amazing work that Ashley and other folks are doing to get meals out, because we knew that there was a lot of folks who were not accessing these programs yet. And so we didn't want to add to the burden of what they were doing. We also saw this really incredible moment where neighbors wanted to help neighbors. The mayor shared a story when we launched the program, I guess last week, where a neighbor dropped off a note at her door asking if she needed anything, any groceries. And so that is really the kind of the inspiration behind this project. And I'll let Karyn speak to some of the details, but the partner that we brought in, Monami, is a technology company that provides senior companionship support services. And they were moving their model over to just volunteers. And so they offered to provide additional capacity. And I'm just, to help folks get prescription pickup or groceries. And then working with Karyn and team to really look at virtual calls and resource navigation, because the main pieces that we're seeing, not just for seniors, but for the LGBT community more largely, is really a need for cash assistance. Our communities are most impacted when the economy is impacted. Going back to that piece around gay affluence, specifically for trans communities of color, already don't have access to potentially healthcare or other essential services. So I know there's a lot to say, and I don't want to take up too much time, but I'm just really grateful for the partnership and the city's response to our seniors. I think there's always need to do more, but the community has really shown up, and through this partnership, we've had over 1,000 volunteers sign up. And so I'm just so excited to move this work forward and really work as a community to support neighbors.
That's fantastic. And just hearing that number, 1,000 volunteers, I think is so extraordinary when obviously so many folks are facing situations of their own. Claire, thank you so much for that account. Karyn, I'd love to hear from you about Open House and the work that you all are doing as well.
Thanks, Daniel and Manny, for having all of us, and shout out to all of the heroes around me. We're in this perfect Brady Bunch configuration, but these are like really rock stars who are leading the efforts, and I'm just trying to be a backup singer to a few of the things that everybody on this screen is doing. Yeah, so Open House is an organization that's focused on LGBTQ seniors. We have 2 buildings of affordable housing that we partnered to build with Mercy. And so we have 119 units there, but we serve about 3,500 LGBTQ seniors across San Francisco every year. And so the things that we've been focused on first was we really wanted to be proactive and start making calls out to people connected to Open House right in the beginning, because one of the things that we know is we all tend to wait till the moment of crisis to say that we need help. I'm definitely that way. My hair, it's reaching crisis level, so I'll be making a call for help soon. But we all tend to do that, and we knew that the system was going to be stretched in exactly the ways that Ashley was talking about. We knew that we might not be ready to respond quickly otherwise, and we also wanted people very early on to get the message, we're here. We're here for you. You can call anybody who's an LGBTQ senior or LGBTQ adult with disability. You can call our main number. We have a live person answering the phone. And one of the things you're going to get is a call back from staff. And so that establishes that safe connection, and people now have a place to go that's specifically for LGBTQ folks. And then we're working with DOS, obviously, to have folks go through their intake line to get broader services or figure out how to navigate the system. But we especially wanted the folks who kind of look to us for that safe place, that community connection to be connected. And so we did about 1,000 calls in the first 2 weeks of shelter in place to start getting connected to folks. The second piece, as Claire was talking about, is we established this partnership thanks to DOS and Clair at OTI, and working closely in partnership with Kaushik at Shanti and the stuff they're doing around volunteers to start to figure out how could we match some of our LGBTQ seniors with LGBTQ folks in the community who wanted, again, who might be in the neighborhood, who wanted specifically to be able to offer support. And the things that you can do to support LGBTQ seniors, one is staff are doing these regular calls and check-ins with people, but there's folks who could use calls more often than once or twice a week, which is what we're doing. There's folks who could use calls every single day or a couple of times a day. And so there's call support that you can do as a volunteer. And then the other piece is around food, which you're going to hear about lots tonight, because that's a huge issue people are facing. And so we have volunteers who are doing grocery delivery for folks, also pharmacy pickup, also technology help, right? How do you get on a Zoom call? That can be an hour or two volunteer effort right there. And that's just to get me on to a Zoom call. So we have volunteers out doing that. And if there are folks who cannot afford groceries, which we know there's lots of folks out there, if there's folks who can, there's a way to set up the payment through the app where there never has to be any exchange of money between the volunteer and the senior, because we didn't want any of that happening. But for folks who can't, Open House is stepping in and funding those groceries for folks, and then figuring out long-term, whether they make sense to go to another organization to get additional support. But we're recognizing again that the system is stretched, that everyone's at capacity, and so we've stepped forward and we're doing that. So we could use your help volunteering. Certainly, if you're an LGBTQ senior and you want connection, like, do not hesitate to call our main number. We're going to call you. We're going to sort it out. We're going to think it through. And then the last part is we are starting to do a lot of our virtual programming. So we do all kinds of fun activities and social connection and parties and support groups. And so almost all of our support groups are now meeting either by Zoom or by phone. And for folks who get our newsletter, that'll be coming out in the newsletter, but you can also look on the website or you can call us and we can talk through that too. Because again, people are, as you said, very isolated, people are alone. And often when we call, if it's been a week or two, people will say, you're the first voice like I've heard directly speaking to me in 2 weeks. And so starting to reconnect back to the community, we're starting to build up the virtual programming because we also think that we're going to probably be doing virtual or not in the same room programming potentially for quite a while. So that's it. You can sign up to volunteer. Echoing what Ashley said, we canceled our gala too. So we're doing some fundraising. I would say give to any organization who's on this screen. I'm the ED of Openhouse. I'm supposed to tell you to give to us, but honest to God, like give to Ashley, give to Toby, give to Kaushik. Shireen and Clair aren't allowed to take your money, so give them pats. Give to the city fund. But really, I'll say this last thing, which is like, there's no silver lining to pandemics. There's no upside, there's no good news. But if we come out of this changed in some significant ways that Ashley was talking about, but also that we as a community and as a city start thinking about seniors and adults with disabilities first, which is what we're being asked to do right now. If that's a way that we can change beyond COVID-19, that would be a significant shift in people's experience where they would stop feeling invisible and start feeling like they matter. So let's figure out a way that we can make that last beyond this moment.
Thank you so much, Karyn. I'm just checking the clock. I see we're at 6:26 and we've got Kaushik and Toby to hear from, who I know all of us are very eager to hear from. So Kaushik, if you could please share with us what Shanti's up to, and then we will throw it right to Toby so that everybody has chimed in.
Great, thank you, Daniel. For those of you who may not be familiar with Shanti, the Shanti Project is one of the city's pioneering nonprofits in building human connection to reduce isolation and increase quality of life and health for people. And it's through long-term, trusted, one-on-one relationships that we ease the often invisible suffering that accompanies isolation and illness. And I think one of the consequences of this pandemic is that the often invisible pain that comes with isolation is now becoming much more visible and visceral for a lot of us. So each year, Shanti serves over 2,000 clients. There's 3 of her programs that have really been stretched more than the maybe some of the others. One is our HIV services programming. We serve over 1,000 HIV positive clients each year. Also, our PAWS, Pets Are Wonderful Support Program. It's the only service in the Bay Area that helps keep very isolated, very sick, homebound folks and their pets together when they otherwise might have had to surrender their pets, who is often their only family. And then, of course, we have our Aging LGBTQ Isolation Reduction Program, which is actually a wonderful partnership with 2 of the other organizations here on the panel, Openhouse and Curry Senior Center. A couple of community challenges we've seen come up that I think Shanti can speak to. One is because we have so many long-term HIV survivors, people who lived through the crisis years of the AIDS pandemic, and oftentimes were infected during those crisis years. They are obviously 2 very different pandemics, but we are hearing some of those commonalities can be quite traumatizing or re-traumatizing. And you know, some of the similarities just starts with the fact that San Francisco is an epicenter for both of these pandemics. And unfortunately, the federal government has just been willfully ignorant and or completely incompetent in trying to give any support. And then something we're also hearing, which is for some of our long-term HIV survivors, they're really feeling as if it's almost like these illnesses are targeting them, right? So in the early AIDS years, it was being a part of the gay community. And now all of these folks are over 60 and they have chronic as well as acute conditions and are most vulnerable to COVID-19. The other thing I would want to point out in terms of a challenge is because we have the PAUSE program is the importance of pets in mental health. I think one of the things we're seeing, you're hearing some of these stories, how everyone's trying to foster animals because it does help us so much. We are seeing folks who are not PAUSE clients reach out to us because it's a human food insecurity issue. Most people, if they have to choose between feeding themselves and their pets, they will choose their pets. And I hope one thing that does come out of this when we're back to more normal times is the realization that any successful, effective, holistic effort to increase community mental health for people must include companion animal support. In terms of how to get involved, you've heard from others as well. I have to echo what Karyn and Ashley said, which is whether an organization has an event or not, for those of you who have not been financially hurt, I know a lot of us have, please do try to support whichever safety net nonprofits you feel drawn to, whether they're on this panel or not. And then you heard a little bit about the volunteering. You know, Mr. Rogers always talked about looking for the helpers in a crisis, and I think San Francisco really lives up to our namesake as the city of St. Francis. But Mon Ami, as you heard, is an amazingly simple app that has been utilized greatly by us and Openhouse and others. We also have the relationship that Shireen mentioned with DOS, the SERVE program, which you can learn more about at helpnow@shanti.org. Just send an email. But Daniel, thank you for including Shanti in this. And I do think we should not lose sight of the fact that as dark as some of these moments are, how amazing it is that so many people have stepped up to try to be there for one another. Thank you.
Thank you so much, Kaushik. And yeah, seeing how all the organizations are working together to unite in this effort has been very, very inspiring to me as well. Next, number one, for the folks who have to head out at 6:30, we're sad to lose you. But for those who can stay, I'm very excited to hear from Toby about the work at the Curry Senior Center. So, Toby, if you could share what the Senior Center is doing and what you're seeing.
Sure. Thank you, Daniel. Thank you, Mayonnaise. So Curry Senior Center is a neighborhood agency. It was started almost 50 years ago in a response to a former director of the Department of Public Health seeing clearly that seniors were dying sooner than they should be because of isolation, because of lack of resources and seeing people they need to see. And so a lot of what's going on right now is kind of contrary to the purpose that Curry Senior Center was built on. We've always tried to get everyone to come out and have contact and meet new people and make lasting connections. And now we're telling them to stay home. Our population is primarily low income and homeless, older adults and adults with disabilities, and mostly in the Tenderloin and Soma neighborhoods. It's a whole person care agency. So we've got a full primary care clinic in partnership with Department of Public Health, case management, behavioral health, technology programs, wellness programs, social and educational programs. And we also have Project Open Hand's first and largest congregate meal site, where we do about 250 breakfast and lunch every day of the year, including Christmas, Thanksgiving. Currently just doing to-go meals because that's all we can do. Because we are in the Tenderloin and always have been, we've always been serving the LGBT community because, as you know, the Tenderloin has been sort of base of operations for a long time for our community. Prior to the shelter in place, we had, every week was alternating between men's and women's LGBT lunch and support groups. Every Friday is Ageless, our transgender and gender non-conforming support group. Every Thursday is Big Gay Movie Day, and we've got a podcast, Revolting Seniors, that is planned and recorded by our seniors. And so we've had a lot of connections with the queer senior population, and now telling them to stay home, we're mostly calling. We're doing, I think, 600 calls a week out of Karyn Senior Center between case management, wellness, and the senior center staff. And some of the challenges that we're seeing, that we're hearing from the seniors, I know some of it's been mentioned before, but people are sort of comparing this to the HIV and AIDS crisis, and it's bringing up a lot of old trauma. We know from experience working with these seniors that that sort of trauma sticks with you, and it's why LGBT older adults are more likely to have, mental health concerns, economic concerns. All of this is because of the compounded trauma that they go through their entire lives. So now we're just stacking more on top of that. And also, there's a real fear that if they were to catch it and survive, that they're going to be shunned and isolated the same way people were during the HIV and AIDS crisis. So we know that there's going to be a big mental health fallout from all of this. And I know that Shireen and Marcy Edelman are working on, pulling together something so that we'll be prepared to respond to it. But we're seeing it already. Let's see. I have notes. Also, yeah, as Daniel had mentioned early on, most of our clients do not have family they can reach out to. They don't have children that can help support them. Our LGBT elders are homeless or live in SROs almost exclusively. Not exclusively, because we get some that will come in from any part of the city just because they're looking for more programs. But those are the ones that need us more than ever, and now we're telling them that they can only come in if it's an emergency. And food related to all of that, part of the problem that we're having is that while all these amazing meal delivery services and Meals on Wheels, obviously, it's fantastic, but it's fantastic for the people that can take advantage of it. And that doesn't include our homeless population and a lot of times our SRO population, because most of our SRO seniors we're finding do not have a refrigerator or a microwave, or they have one or the other, not both. And I would say the largest part would never want to use the shared kitchen space in an SRO either. So the food security in the Tenderloin is bad as it is because it's a food desert, and the best that they can do is, the corner stores or Glide, St. Anthony's, Curry Senior Center, Project Openhouse. And so we're really trying to pay attention to make sure that people are still getting access to that and figure out what we can do to make sure they maintain that access. We did start a weekly Zoom last Wednesday. We had another one today for our LGBT older adults, and there are a lot of technical difficulties that we're working through, but we're getting them logged in and they're participating, and it's fantastic. And it's really good to hear that most of them are sheltering in place, and the ones that can participate in this really appreciate still having contact. Our phone calls are great, our emails are great, but getting to see the faces when they're making fun of each other's quarantine hair, it's fantastic and truly deserved for all of us. So I think that also our problem is a lot of our seniors don't have internet at home or easy access to the technology that would let them use it. I know that the Community Tech Network is working on connecting more seniors with internet as well as some sort of device that they can use. Hopefully this and anyone else that's working on something like that can get moving, because we're losing contact with some of our seniors, and we're worried what happened when they go off the grid. When MSC South shut down, we had several clients that were staying there, and we don't know where they are now, and we're not necessarily being told. And you get to know, they're not just people that walk in the door. These are people that I see every day, and we worry about them. So we're trying to trace everyone down, but if they all had a working cell phone or a tablet or a laptop, it would be that much easier. Right now, we are not doing volunteer opportunities because honestly, all of our volunteer opportunities were serving meals, hosting parties, everything just to engage and interact with our participants. So instead, we've actually been referring everyone to Shanti. So hope that everyone does continue, try and get in the way they best can to assist anyone. If you are or know someone who is relatively tech savvy and want to donate time, we are looking to see how we can get more of our programs online. And we're not necessarily prepared for that. We're a Tenderloin Senior Center, so our level of tech is specific, and we have very good technology stuff, but it doesn't necessarily fit the need now.
Thank you so much, Toby. As we conclude the program, were there any kind of closing thoughts that folks wanted to share? And were there any folks in the audience who, or Ashley, were you going to share something?
I was just going to say, one of the things I always try to stress whenever I have an opportunity is kind of the hidden poverty of people aging in the city, and the need for us to understand and learn more about what's called the Elder Economic Security Index, and what it really means to live in poverty in San Francisco is not $1,000 a month, which is most 80% of our clients live on that or less, or Curry's clients or what have you. But you need $29,000 a year of income to meet your basic needs as a single person aging in the city. And I just think that this is a conversation we need to engage in once we get past the initial things that we have to do to keep people safe.
A really, really important point, Ashley. Just want to throw it out to the panel a final time if there's anything folks wanted to share.
This is Claire. I just there was a question in the chat around the top 5 agencies to give to. So I think they're on the call. You know, supporting Ashley Work's Toby work, Kanish work, Karyn's work. And, you know, also I think it's really important to support the Barrier Relief Fund, because we are working with Horizons Foundation to help supplement city support, as well as other fundraising that agencies are doing. But we know that oftentimes there are not matching dollars or ways that our LGBT agencies can really have a reserve fund. And so just really encourage folks to give if they have resources. There's many foundations that are local that are really working to provide organizations relief at this time. In addition, you know, obviously the city will be very impacted by this financially. And so DOS and others are doing everything they can to provide resources, but we really need to also call on our state and federal legislators to make sure that our community is included. So please also get engaged in any ways you can to make sure that your voice is heard, and that we can make sure that our communities get the resources they need.
Thank you so much, Claire. So I am seeing, just since we do have a couple minutes, I do see a question here. What do you all think about the nationwide concerns about rationing care based on age and disability if hospitals don't have enough beds or ventilators? So I think that the issues around ageism and ableism have really come to the fore in this crisis. And I think my personal hope is that it's highlighting the fact that each one of us at whatever stage of life is a human being of equal worth and of equal dignity. In terms of directly the policy around triage in hospitals, that's not something that I have any expertise in. Would anybody on the call like to address that?
Well, I don't have expertise in that either, but I do think that one of the most important things we can do to protect our communities is to stay at home and to really help the, health professionals who've said we need to flatten the curve. That's what we can do. We can stay at home, we can listen to that, and we can think about making sure that our hospitals don't get overwhelmed. I do know there's an organization called Justice in Aging, which has come out with a statement that basically says, you need, in anything related to COVID-19, we need to think about how we're avoiding ageism and ableism, and how we're really making sure to have ethical conversations, and to bring in all issues you know, what, with anything related to this. And I think that, you know, we do need to do that. We need to think about things from every angle, and people with disabilities and older adults need to be part of those conversations. And, you know, I think it'll be a much different conversation if we're involving people we're talking about, just like anything else. We can't make decisions without having everybody's voice.
Thank you so much, Shireen. Just
I
want to
can-
open up back.
I can just add really quickly
yes,
to that,
please.
Daniel. Shout out to Jessica from Senior Disability Action, who I think sent that question to us. They're another good group, and supporting them and their advocacy work is a good move. But I think also, like, you know, all of us of every age need to be doing this, but it's particularly important for seniors, people living with disabilities, to figure out who your advocate is, both in terms of your power of attorney and that sort of stuff, but also like who's going to advocate for you, and what is that advocacy going to look like. And this is where care managers and care navigators and others ruled. I mean, that we would all talk about us all falling apart. Shout out to every social worker out there, because they're often the ones who are doing that navigation for people who don't have someone else. So, but I would say for everyone thinking about who's going to fight like hell for you, and we'll figure out who that can be. I know any of these organizations will help you figure that out if you don't have someone. Is just really critically important at the individual level, and then get involved with advocacy groups at the larger systems level.
Daniel, could I throw out one more thing? I just really can't let this any opportunity go to call out the people who are really doing the work and showing up in the kitchen at 5 and 6 o'clock every morning to make the food, the people who get in the vehicles and go out and do the work, the people who are coming to the office to make the calls. And if we're learning nothing else in this crisis, is how to value people who make our world work. And we need to make sure that that doesn't go away when this crisis does eventually, go away. It's really a lesson for us to keep.
There was a question, thanks, and thank you for everybody's patience as I learn how to use the system a bit. There was a question that came up about doing a Zoom neighborhood meeting. And the question is, would any of us be able to join? This is from Marianne Hampton of Upper Knowing Neighbors. So I will throw that out to the group, if folks would be available to participate in a neighborhood meeting, or perhaps Marianne, if you could reach out to one of us individually and let us know how we could assist your group. And then there was another question on here that disappeared. I'm not sure how. That was asking about tech support. And let me see if I can find that. It appears to be gone. But I believe it was somebody offering tech support. And unfortunately, so it was maybe something helpful to all of us. Whoever that was, thank you so much for what you posted. I hope you'll reach out to one of us so that we can put you in. Yes?
I sent Karen's email and my email to the person that asked that question.
Excellent. Okay, great. Okay, if there are any other questions from the attendees, if you could please share them. I'm not seeing any additional questions, so I just want to thank again everybody on the panel today for your time, for your expertise, and for your extraordinary work. Thank you again to Manny's for providing this incredible opportunity to share what all of you are doing in this crisis. And again, please don't hesitate to reach out to any of us, those of you who are attendees, if we can be of assistance in some way. Thank you again, all of you.